Welcome everyone to the webinar on gender equity and access to health from a human rights perspective. I am Maria Kusa, the Division Manager of the GHI Academy. The Academy is the capacity building arm of the Global Health Institute at the American University of Beirut. This is the first installment of the webinar series on gender and global health. The webinar will be delivered by Chaitali Sinha. Chaitali is a senior program specialist for the Maternal and Child Health team at Canada's International Development Research Centre, known as IDRC. She has over 15 years of experience with research for development in Africa, Asia, Latin America, and the Middle East, with a particular focus on global health. Chaitali's areas of interest and expertise include sexual and reproductive health and rights, feminist and gender research, health information systems, the use of digital technologies, and translating knowledge to maximize potential for large-scale positive change. Chaitali will be delivering her presentation, which will then be followed by a 10 to 15 minutes Q&A session. So please feel free to type in your questions as we move along the presentation. We will be also including poll questions, so I would like to encourage you all to vote and provide your input into these poll questions. So without further ado, we are excited to welcome Chaitali, and Chaitali, the floor is yours.
Thank you very much, Maria. Good morning, good afternoon, good evening to all of you, depending on where you are. I am very pleased and honored to be the first of 3 speakers in this Gender and Global Health speaker series being hosted by GHI. And I will be talking about the topic of gender equality, human rights, and global health from a research for development perspective. So what I've decided to do in terms of structuring the presentation is to begin by situating the discussion in terms of some key terms and concepts, some historical milestones, etc., just as a backdrop. Moving from there to talk a little bit about the International Development Research Center where I work, and you can't hear me. Can you hear me now? I've been told, okay, you can hear me. Thank you. Okay, great. Thank you everyone for, so I was just saying, how pleased I am to be the first of 3 speakers in this seminar series of webinars on gender and global health. And I will be talking about the intersection of these topics of gender equality, human rights, and global health from a research for development perspective. And the way I've decided to structure the presentation is to begin by situating the discussion with just some key terms and concepts which I'll be referring to throughout the presentation. Then also some key milestones in terms of what's happened in history that relate to these topics. Moving on from that to talk about the International Development Research Center and how we approach research for development and what the research for development knowledge gaps are when it comes to looking at global health from a rights-based gender perspective. And then I want to finish by having some concrete examples that I want to share with you, because I think that examples are a really strong and effective way to bring together a lot of ideas and present them in ways that can actually have more meaning. And from there, I'll share some reflections. So as pleased as I am to be able to share with you my observations and ideas and experiences, I'm also keen to leave a lot of time to hear your questions and to also learn from your experiences and have you share your thoughts at the end of this webinar. Now, moving on, there we go. So I wanted to start by showing this graphic that I got from an article that was published in the Lancet in December of last year. And it shows the last 70 years of international development of human rights when it comes to health. And in particular, I wanted to draw your attention to 3 of these milestones. The first is in 1948, the Universal Declaration of Human Rights. In 1978, the Declaration of Alma-Ata, which foregrounded primary health care for all. And then more recently, the Sustainable Development Goals, or the SDGs, which is of course grounded very much in a rights-based approach and focuses on gender in many of the goals and many of the targets within them. So by the end of last year, it did mark a lot of interesting milestones. And I'm just gonna, this is not an exhaustive list, but just to give us a sense of what we're building on. It was the 70th anniversary of the Universal Declaration for Human Rights. It was also the 70th anniversary of the World Health Organization's constitution stating health as a human right. It was the 40th anniversary of Alma-Ata, which, as I mentioned in the last slide, was about focusing on primary health care and making sure that it's available to all. It was 23 years post the historic Beijing conference, which was a very important moment for the gender and the women's rights movement, and 25 years after the International Conference on Population and Development, which took place in Cairo, which was a pivotal moment in terms of taking a rights and a gender-based population and development framing on things. Excuse me. So, with that as a backdrop, as I mentioned in the first slide, I will be talking about the intersection of these three very important and vast topics, global health, human rights, and gender, each which warrant a multi-hour introductory talk in and of themselves. But what I will be doing is looking at the intersection of that with the research for development lens. And in particular, much of IDRC's health research focuses on implementation research, which broadly speaking is the what, why, and how interventions work in the real world and finding ways to make them work better. Now, some concepts and definitions. I don't want to spend too much time on this, but I do think it's important because I will be referring to these terms throughout, and I want to make sure that we have a common base in terms of what we're talking about. Gender, sex, and gender diverse. Very simply put, sex is really about biological attributes, whereas gender is about socially constructed roles and behaviors, expression, and identities. And just to mention that gender is not a synonym for women, but it really is about power relations and power dynamics. And then finally, gender diverse persons. It's a person who might not identify with the sex that they were born with. So you might see these terms coming up later on in the presentation. Next, I'll talk about gender equity, gender equality, and liberation. So gender equity is grounded on the idea of fairness, and you'll see that the first poll has just popped up on your screen. So I do invite you to please share your ideas with us. Gender equity is about fairness, and it's about treating everyone fairly. And I'm sure that many of you might have seen variations on the graphic that I've shown here below, which is showing a fence and then three people of different heights and whether or not they can see or they can't see what's on the other side of the fence. Gender equality is about that people are considered, valued, and favored equally. It means that different behaviors and aspirations of women, men, and gender diverse peoples are favored and valued equally. And there you have the graphic that shows that. And then liberation is more about systemic change. And you'll see here in the graphic, the fence has been removed entirely. So it's a change to the system and the structures that have taken place. The next term I want to spend a bit of time on is intersectionality. And this is a term that's not reserved for gender analysis, but in this case, I will be speaking to it vis-a-vis gender. It is an analytical tool to understand the way in which gender intersects with other identities, and then how this intersection contributes to a unique experience of either oppression or of privilege. And you'll see in the image on the side, there are a lot of different identities that are shown there. And it's the whole idea that it's not essentializing a person to have only one label, but a person or a group often carries multiple identities and multiple labels. So to be cognizant of that when collecting research data, when designing research programs, and also of course when analyzing and presenting research results, to take that into account. And I should say that I know that we have a Q&A session at the end of the webinar, but if you do have pressing questions that you would like to ask during, please do so, and I'll either get to it during the presentation or during the question and answer period that follows. So now we're at the so what point. So I've given some concepts, definitions, and things like that. So why does all of this matter when it comes to global health? Thinking about research and a rights-based approach, a rights-based approach is about respecting the UN conventions of non-discrimination, participation, accountability, and transparency, and thinking about this throughout the research cycle, from the design through to the implementation. It's about thinking about women, girls, boys, men, and gender diverse people and their rights, not just individually, but also collectively. And that's an important point that I wanted to stress. And then for those of you who are familiar with rights-based approaches, you know that there are generally two broad groups that we talk about. There's the rights holders, and then there are the duty bearers. The former group, the rights bearers, it's people, rights holders rather, it's the people who have rights, and you want to make sure that everybody is able to claim their rights and exercise their rights. The second group, which is the duty bearers, it's what the third bullet on this slide refers to. It's the people who have the power and the formal obligations to protect, respect, and fulfill human rights. So being able to develop the awareness and the capacities of these groups is also very important to have a sustainable and a meaningful rights-based approach integrated within research. In terms of what this means for global health, women, men, and gender diverse people, they exercise their rights and they experience health systems very differently. Whether that's due to environmental exposures, whether that's due to differences in occupation, in exposure to conflict, a range of things. The fact is that people do experience health systems and seek care in different ways. Specific groups like youth, adolescents in particular, various displaced populations, and those living in fragile contexts do need special attention. And this is not just because these individuals and groups have health needs that change very quickly and are at times very acute, but also because the health systems that they're accessing and the health services themselves are very susceptible to shocks to the system, to shifts in the system, and are oftentimes very weak or absent entirely. So it merits a lot of attention when thinking about those particular groups. So the absence of this sort of rights-based gender analysis when it comes to research can be tantamount to being blind to differences in decision-making power. This is within the household, outside the household. It is being blind to how differences exist in access to health and other social services. And it's also being blind to ingrained societal gender discrimination. And as we know, if one is not aware of things, they won't be looking for it. And if you're not looking for it, then you won't capture it and you won't be able to analyze it. And in the end, the final analysis will be partial and may even be harmful because it doesn't take into account these very important social realities that are at the root of some of the development challenges being faced. And on that note of data and measurement, so always on the, sorry, I was just trying to read a chat that came through, but data and measurement. In terms of health information systems, gender disaggregated data is very important in helping to inform more effective and targeted delivery of services. And you'll notice I mentioned gender disaggregated data rather than sex disaggregated data. And as we all know, sex disaggregated data is very, very important, but gender disaggregated data goes beyond. It looks at, thinking back to that slide I showed on intersectionality, it takes a look at various social markers that are important in determining why people seek care the way they do, why they experience health the way they do, etc. And again, the idea of certain groups just not being visible in the data, this is a very powerful point because oftentimes it is the most vulnerable groups that are not counted. So it really gives a false understanding of who's being captured in the health system, and therefore it's important to bear that in mind, that data can have gaps, and those gaps are important to fill. The issue of civil registration and vital statistics is very important and linked to this last point about being invisible and not being accounted for, because birth, marriage, and death registrations are critical in terms of a means of documentation for people to access their rights, to exercise their rights, to access social protection, and then to advance gender equality. And I'll talk about this a little bit more when I get to the examples. And then finally on this slide, taking a step back and recognizing that data is not gender neutral. So whether it's the way data is defined, the indicators, the collection that's done, the interpretation and the use, these are all gendered processes in and of themselves and should be understood as such. Now, next slide is about IDRC and how we approach this. And this is a very brief set of slides because I do want to get to the examples shortly after. For those who might not be aware of what IDRC is, it is a Canadian organization that's part of our official aid program. We have been around for almost 50 years, since 1970, and our focus is funding research for development in developing countries that's done by researchers based in these countries to address various issues that are challenging their social and economic and other forms of development. What we do is we do, apologies for that, we do provide grants, technical assistance, and also focus a lot of our attention on strengthening capacities of emerging and established leaders. So just to say, a rights-based approach and gender research are both critical to all of the work that IDRC does. And IDRC, as part of the Canadian Official Assistance family, we do also adhere to the Feminist International Assistance Policy that was launched in Canada a couple of years ago, in which gender equality and women's empowerment, or empowerment of women and girls, is a cross-cutting issue. So it's a really important part of the work that we support. And what does this look like? It means that a lot of our research is supporting issues around gender equality, facilitating women's empowerment, and building capacity of female researchers, but also of all researchers to do strong gender analysis and rights-based analysis. And IDRC does this by acknowledging that a lot of what needs to be looked at is the structural and the root causes of gender inequalities. And as such, a portion of IDRC's funding actually looks at gender transformative research. And this is a term that really means that the research is looking not just at changing the symptoms or the outcomes, but it's really looking at changing the systems and the structures that are in place to have transformative effects. The program that I work within is the Maternal and Child Health Program. You'll see there are 3 bars on this graph. There's the middle bar, which is our core programming on adolescent sexual and reproductive health and health information systems. The one on the left is the Center of Excellence on Civil Registration and Vital Statistics. And the one on the right is Innovating for Maternal and Child Health in Africa. Each of these do take a rights-based approach to its gender analyses, and instead of explaining what they do, I thought what might be easier is to just jump right into some examples that will hopefully make it self-explanatory, and we can discuss more during the Q&A period if needed. Now, the first example I'm going to mention is one that is a cohort of grants that ran from 2012 until about 2017. And they were implementation research grants looking at digital health, health equity, governance, and systems integration in the different countries, the 7 countries you'll see listed on the slide. The way in which this cohort was designed is right from the beginning, gender and rights were one of the cross-cutting issues that were being supported throughout. So it wasn't just something that was done at the level of the 7 projects, but at the level of the cohort. There was a lot of activities and emphasis done to ensure that was looked into and reflected on and addressed. So as a result, gender relations and dynamics were really looked at in terms of health workers, beneficiaries, decision makers at all points of the health system. The results that, there are too many to list, but I just wanted to give a sampling of some of the qualitative and quantitative results. In terms of qualitative results, which is really significant, is there is an improved understanding of gender roles and dynamics and greater engagement of different groups who were not involved before in whether it's gender-based health decision-making or just getting involved in intra-household decision-making that can help improve gender equality and better health outcomes. A large number of health workers trained, many women registered and as a result followed systematically into a health information system. These women are also able to access their own health records, which is an interesting example of more agency and empowerment to take ownership of your own health and well-being. And there were several examples of improved health outcomes. So whether it's improved outcomes in assisted births or a range of other health outcomes that we were measuring as well in this cohort. If you are interested, there's a special issue that was published last year in December, so last month really, and it looked at the results across the cohort so that different countries have papers in them. There's also a paper dedicated to gender dynamics across the cohort that you might be interested in having a look at. The second project I'll be talking about is reducing early marriage of adolescent Syrian refugees in Lebanon. This is another implementation research project, and it is being led from the Faculty of Health Sciences in the American University of Beirut. They got started last year, and it's a 3-year project. And the project is taking a really strong rights-based, multi-sectoral intervention approach to understand the drivers of early marriage and to also design an intervention to help address these drivers by involving different groups like married and unmarried girls, mothers, boys, and other groups in the community who are very important in the process of deciding whether or not early marriage is something that is pursued or not. So gender relations, power dynamics, all of these things are very critical to how this project is doing its work. Some of the expected results are increased school attendance, levels of knowledge, access to sexual and reproductive health information and services. So that can be things like menstruation and hygiene or reproductive health services, depending on what the needs are. An enhanced sense of empowerment and agency among especially the young girls. And eventually a reduced number of girls who are getting married before the age of 18. The third example I'm going to talk about is focusing on civil registration and vital statistics. And you'll also notice that the projects I've been showing, there are various funding amounts too, just to give you a sense of the fact that IDRC does work in terms of cohorts, in terms of single projects, bigger projects, smaller projects. But they all really do take an implementation research approach. And this project is very interesting. It's in Ethiopia, and it's looking at internally displaced women and children and the impact of under-registration or undocumentation of these individuals when it comes to exercising their rights and services. So it is looking not only at the existing laws in place, but what is happening, what is the magnitude right now of registration, and what is the degree of vulnerability experienced by those who are not registered or are not documented. And then designing an intervention to increase registration, whether it's through training and awareness or a range of other things. There is an intervention plan to do that, with the expected result that registration will increase, that service provision will improve, that monitoring and compiling of these statistics will improve as well, which is very important to making sure that these groups are being counted so their needs are no longer invisible. And to enhance the evidence base to find the link between the role of CRVS in reducing vulnerability. And the final example I wanted to share with you is one from West Africa. And this is about looking at the intersection between sexual and gender-based violence and adolescent sexual and reproductive health rights. It does take a combined policy and practice emphasis. Currently, there are 2 grants that have been approved, which are both multi-sectoral and both interdisciplinary in their approaches, with plans of growing this cohort in the future. So there are 2 grants now, but there's a plan to have it grow even more. What the project has done, which has started last year, is it's really taken a lot of care and time in terms of identifying the priority research questions to set out an agenda to address the knowledge gaps and the implementation gaps that exist, working collaboratively within the projects and outside through workshops and other means to get to those root causes. So going to the expected results, it's of course, to reduce SGBV and improve ASRH. It's to share thinking and the research agenda and things like that that have come out so far through the mapping report that was shared at the workshop last year. It's to work across silos, not just sectoral silos, but in terms of the issue silos in this case. So here we have SGBV and ASRHR, which are very deep and complex issues in and of themselves, but oftentimes the root causes are common. So to work across those issue silos, to look at those root causes and understand how they interact with one another. The intention is to build a cohort and critical mass of West African researchers who are steeped in this type of rights-based approach and strong gender analysis, and to mobilize additional research interest and resources to then continue to expand this cohort to address the need for this type of work in the region. Now, I wanted to finish because I realized I shared a lot of information for examples, and I thought it might be useful to have a slide to capture some observations and lessons. So in terms of observations, I just wanted to share that the how and who with is just as important as the what. And so this idea of nothing about us without us really comes into play here. Recognizing that health systems in and of itself, the policies, interventions, the structure entail its own gender dynamics. It's something that keeps coming back as something that needs to be thought about. That involving everyone to have truly transformative effects is important. So you can have interest groups for sure, but the projects that I've found that have had really sustained efforts, even if they haven't involved everyone to the same degree, when you have an interest group, to really make sure that you're looking at the power relationships and the power dynamics that exist between them and others, and involving those other groups. To make sure that the data that is used at different levels to drive decision-making and resource allocation does count the undercounted. Here I've put women and girls, but it's really any group that's been historically marginalized or oppressed that needs to be made sure that we are capturing them in the data. And then the importance of capacity strengthening on a rights-based gender analysis is important, because doing it in a way that's rigorous is not something that's very easy. And then related to these observations, I've summarized a few lessons that positive transformation change does require processes that are inclusive, responsive, locally led, and ethical. And I could spend an hour talking about each of those if you want, but I'll just leave it at that for now, and we can talk about it more during the question and answer period. That systems approaches to examine root causes and their outcomes are really important. So trying not to, it's always great to have an entry point, but to recognize that it is part of a broader fabric. Using intersectional analysis to avoid stereotyping and rather embrace diverse aspects of identity and experience is very powerful. And I think it's something that is being done more and more, which is very exciting to see. And that data are not neutral. So to step away from any assumption that that is the case, and to look at unpacking the social, political, legal, and ethical aspects of who decides what data to get, how is it gathered, who gathers it, who analyzes it. It's all very political and anyway, not neutral. And then linking back to the observation here, that capacity strengthening for all is really important. And I wrote here with a focus on supporting women's organizations, just because there's a lot of organizations that are doing excellent work, and they don't often get the support to do the capacity strengthening that they might want to do. So finding those pockets of people doing interesting research for development and making sure that they get the support that they need. And with that, I will stop. And I see that we have one question. Now I'm going to ask Maria to see if it's possible to get a sense of the polls that...
Yes.
Oh, there we go. Sorry, go ahead.
Yes, so I'll be sharing, so I'm going to start by sharing the results of the first poll.
Okay, should global health... Okay, that's interesting to see. And then...
Shall I move to the second?
Yeah, well, maybe maybe leave it up there for a minute just to see if people have any comments on that, because I don't want it to just rights-based gender. Yes, I can. Sorry, I just saw. So maybe if there are no questions on that, then maybe we can move to the next one, Maria. Okay. Okay, are you currently using the rights-based approach? Okay, that's really interesting that 71% are thinking about or using a rights-based approach when thinking about your own work. If there's anyone who wants to share any reflections on that, or maybe what we'll do is we'll go through the other ones. I think there's 2 more, if I'm not mistaken, Maria, and then we can see if people would like to discuss them. This is, I see, when would it be? All stages, okay, that's good. A lot of people mentioned all stages. But it's interesting to see, I did write where would it be most useful, that it is interesting to see the analysis stage, communicating, and design stage come through. And I think there was there one more, or is that, and I'm just going back to the rights-based approach. This is one, okay. Okay, this one I'm really interested in. Limited knowledge to implement, okay. That is a very interesting set of findings in my opinion, because it really goes to show that it's not just one bottleneck that's leading to this kind of challenge. It's really a mixture of things. It's funding interest, community interest, budget time, as well as having the knowledge to do so. Okay. So I'm just trying to multitask here. It's really hard. There are all these questions coming in, and I'm just trying to make sure I don't miss anything here. So I know that somebody had asked to go back to the rights-based gender slide. So I've done that, and plus the results on the first poll. Okay, so maybe I'll leave that slide up, and I'll go to the questions. And so the first question is from Belen. Could you give examples? Gender disaggregated data is not just... Yeah, that's a very good question. So I'm not sure if everyone can see the questions, but she's asking about gender disaggregated data and getting an example of it. So it's really about disaggregating along things like geographic location as well. It could be along levels of education, income levels. So in addition to disaggregating by sex, you have these other socioeconomic and other variables that are also being analyzed alongside them. So instead of having results that say women experience X more than men, you can actually say women with this income level and this level of education seem to be experiencing this more or less than women of a different education level and a different income level. So it just gives a lot more of a richness to who you're looking at. It's not just it's not a biological marker alone. It's your social experiences. So what I'll do is I'll go through the questions, and I'm not sure if Belen, I've answered that accurately. Please let me know. If not, I can give it another go. So moving on to the next question from Mirthe. It's about collecting gender disaggregated data can pose risk to participants. How do you mitigate this? A really, really good question. The whole ethics around researching, especially when you're looking at vulnerable groups, groups that are under the age of 18 or living in fragile contexts, it is a very delicate matter that you have to look into. There are some gender disaggregated data that are less risky than others in terms of placing risk to the people that you're getting the data from. So I think it comes down to, in my opinion, what you're asking, what the other social markers are that you're trying to get at. If it is something like dynamics of income and education, you'd have to kind of play it by ear and see if if the data is in fact anonymized and there's no way to find out what's happening, and if the participants were given an opportunity to understand the informed consent and they know that they have a chance to withdraw whenever possible, I don't see there being any categorical ethical challenge when it comes to collecting gender disaggregated data. In some ways, I think the same challenges would exist collecting sex disaggregated data. It's really about following a sound ethical protocol, and not just something that gets approval from the ethics review board, but something that you as a researcher feel that it's in the best interest and responsible towards the people that you are working with. So that whole idea, again, nothing about us without us. So really thinking about the people that you're working with having a stake in the game. And oh, I see a response. You could share references. Yes, Belen, I just saw your response, and I would be happy to offline share with you some references about that. So I'm going to move on now to, and if others are interested, let me know, and I can share it with the whole group, or I can share it just with Belen or a subgroup. It's my pleasure to do that. So Rahul Deep is asking about, oh, interesting, analysis of suicide among different populations since 2001. Quite interestingly, came across that data from 2014 that also has aggregated data for transgender as well. For the second phase, we are planning nature and cause of suicide. That is really interesting. Rahul Deep, what I've come across in my own experience is that I don't know where your research is being done, but in countries like Nepal and Bangladesh and India, the inclusion of an other sex category or transgender or something is actually they're leading the way when it comes to that. And it really does make a difference for doing research on these issues. So there's, yes, okay. Yeah, in terms of the death certificates and registration, this is a huge challenge. And some of my colleagues here on my team who work specifically with the Civil Registration and Vital Statistics Center of Excellence can talk a lot about this, but they're funding a lot of research globally and also in specific countries that is looking at strengthening the processes to not just get this death certificates documented, but to code the deaths in a way that is meaningful. So there's an ICD-10 coding of deaths that should be used when deaths take place. Using that to understand what caused the death is important for health planning, but then also the death certificates are so important for claiming pensions, or especially when you have, for example, under early marriages happening, and you have, let's say, a young girl, a woman whose husband has died, and all of a sudden, without the ability to, first of all, show that they were married, so having a marriage certificate is very important, but then having a death certificate to then lay claims to any sort of inheritance or other things that one might be entitled to is very important. So I couldn't agree with you more on those issues. And offline, I would be happy to share with you some interesting briefs and reports that have been done by the Center of Excellence on Civil Registration and Vital Statistics. So I just want to see if I'm missing any other questions. And I'm also looking at the chat. Okay, so were there any other questions that people had about the presentation, about the examples, or about the observations or the reflections that were shared? Because those are very personal, and by no means, I mean, I would invite you also to question or challenge them, because I would like to hear from your experiences on these things. Well, I'm gonna turn to Maria now to see what she suggests that we do.
Yes, I just wanted to flag out that we just received a question from Marilena on won't a gender inclusive healthcare system cost too much?
Okay, that's a good question. It depends on what you mean by gender inclusive healthcare system, because in some ways, a lot of what we're talking about in terms of a more equitable health system and things like that, there is obviously a whole field of health economics that looks at these kind of equity analyses and how much it costs a system to provide people with quality healthcare services earlier than if you lead people to have catastrophic health expenditures later on, because they were not, their needs were not addressed early on, and they were not addressed in a way that recognized their own their own experiences and exposures that led to it. So I would love to have a lovely, like, long debate about this with you, because it's a very interesting question, and I think you can come down on it on either side and say it does cost too much and there's no point in trying. But the other side, you can come down on it and say, well, you know, a lot of the work that's happening in terms of investment into health systems is happening anyway. So censuses that might happen in some countries but might not in other countries, demographic household surveys, things like that, they are looking more at addressing different indicators and trying to get more indicators. So sometimes it's not about changing everything about a system, but it's about looking at how existing processes and investments into them are working and making little tweaks to them to make sure that it's leading to some real change. So I hope that answered your question, but I would love to chat more about that with you offline, because I think it's a really good question.
We have another question from Merit. Why were men not included in the research on early marriage among adolescent Syrian refugees?
Men were included, so I didn't put everyone down there. So when I spoke to it, I said, and other community members, but they were. It was married and unmarried girls, their mothers, boys of the same age, but of course fathers were also a key part of that, and I probably should have included that in the slide. Fathers and other community leaders were also being involved in that. And now I see the other question here, and I hope that answers your question, and please let me know if you want me to elaborate. And oh, before I go to the last question, I see that to Marlena's question about a gender-inclusive healthcare system, Tatiana has said, do you mean paying for women's care would cost more than not? Oh, I see. Tatiana's asking Marlena a question, I think, there. So maybe I won't answer that, and I'll let Marlena answer that. The last question from Fatima that I see is, perhaps you can elaborate in point 1 in the observations. So let me just go back to the observations. And so yeah, what I mean by this, the how and the who with is just as important as the what, is that when doing research, I think oftentimes researchers are very focused on getting the research question right. So doing the literature review, knowing what's done, identifying the knowledge gap, writing a good research question, and then designing methods. And it's not always that at that early stage of even designing the research question that people are actually thinking about who needs to be involved even at this stage of thinking about what the knowledge gaps are. Because you can look at things from, we all have our own experiences, and we all sit in our own spaces, whether it's in academia, whether it's in a civil society organization, whether it's in a grassroots group, whether it's in parliament, and thinking about who needs to be involved and how. I think that's the important thing as a critical part of designing your research. That's what I was trying to get at. So the what is important, but I think when it comes especially to doing research, the what can sometimes overshadow the how you do the research and who you do it with, and not who you do it on. That's the other thing, is not doing research on people or on something, but it's doing research with them. Okay, and then are you referring to researchers or participants? So I'm talking in terms of the who with, I'm talking about really everyone. So the researchers who are designing the research need to maybe involve other researchers, but they also need to involve the participants. And again, it depends on what you mean by participants, because that can be community members who are expected to benefit from what's happening. It can be decision makers who are expected to use the research findings to improve their own work. But generally, it really depends on the question that you're asking. But this refers to researchers and how they're thinking. Oh, now I think I know what you're saying. When I'm saying that researchers need to look at how and who with, I was focusing that comment towards researchers, but it can work. It also would apply to participants as well, is that whenever you're doing any type of social change activity, really thinking about the how and the who with is just as important, if not more important than the what, because the awareness and the trust that you can build among different groups can be so important that even if the what is a little bit off, you still gather the positive momentum and the trust that's been built by the processes of engagement. So, another question, maybe come up. Okay, great. Thank you, Fatima.
So that's great. Thank you everyone for participating, for joining us, and for the Q&A. I'm sure you'd all like to join me in thanking Italy for such an insightful and engaging presentation. Italy. I don't know if you have any closing remarks.
Just to thank all of you for taking your precious time and joining me for this, and that I look forward to staying in touch with those who would like to stay in touch, and to maybe seeing you in the subsequent webinars in this series. Thank you.
Thank you. So yes, on that note as well, next Thursday we will have the webinar on women's health and protracted crises. And the week after, we'll have a webinar on gender-based violence, a global health challenge. So I would like to encourage those who haven't registered yet to register for both webinars. So thank you so much, everyone. And have a lovely day, evening, and night, because we're all in different time zones. Thank you.